give the disarray? An expert, you say? Well, in my expert opinion, Mr. Banana has a benign paroxysmal positional vertigo, or BPPV. This happens when inner ear structures called otoliths break up, forming debris made of calcium carbonate. We can call these ear rocks. These may be formed as a consequence of infection, senile degradation, inner ear disorders, or trauma. Like, for example, Mr. Bananamon himself got thrown out of his boat. So now, these ear rocks are being floated around either of his ears, a condition called as canalithiasis, which will contradict the signals of the opposite ear's otoliths, resulting in mixed signals to the brain. Why? You should know why that's LU3 territory. Well, what's even worse is having cupulithiasis, which would mean the rocks on the top of the cupula of the posterior semicircular canal. If that's the case, he may not be as responsive to particle repositioning maneuvers like what I'll be recommending Mr. Banana to do right now. Start with a sitting position. Mr. Banana, listen! You will turn your head 45 degrees to the right. Are you doing it? Okay, very good. Lie down and stay that way for 30 seconds. Then, turn your head 90 degrees to the left and stay for another 30 seconds. Get off your bed, stay for another 30 seconds. This is probably a problem for you, with your condition. Well, okay, lastly, sit up, and after, wow, a couple minute delay, you can finally get up. Get? Ah, yes, great. It's time for hot tea now, Bon and Pula. Thank you, dear. Bon and Pula, please, stay steady. Ta-ta!
Ayan, magandang umaga. Sa nakita natin, yung pasyente, ay hindi pala, yung contestant ay may tinnitus, may hearing loss, may dizziness, at may nystagmus. Itong mga simptomas na to, nakikita natin yan sa mga may sakit na tinatawag na labyrinthitis or neuritis. Kasi sa sakit na to, yung mga bacterial at saka viral pathogens, ini-infect nila yung labyrinth na nagko-contain nung cochlea, nung vestibular system, at saka ng mga nerves na nagko-connect nung labyrinth sa brain. So, ang nangyayari, yung mga pasyente, nakakaranas sila ng disturbances in hearing, tulad nga ng tinnitus, at saka nung hearing loss, at saka ng disturbances in balance, tulad nung dizziness at nystagmus na nakita natin dun sa contestant, kaya hindi siya makalusot dun sa obstacle. Yung symptoms ng labyrinthitis pwedeng mild, severe, temporary, or permanent, depende dun sa severity ng infection. For the treatment naman, yung bacterial infections, syempre, natural na paggamot ay yung pag-inom ng antibiotics. At sa viral infections naman, usually, hinahayaan lang yun dahil self-limiting naman. So, usually, supportive care lang tulad ng bed rest, good hydration, at saka yung antipyretics for fever. Yun lang. Fever. Ganun na.
What's up, Carla? I believe the patient has Meniere's MD disease, okay? Let's call it MD. Now, in MD, there is increase in endolymphatic fluid and pressure inside your inner ear, leading to the triad of Meniere's disease. 1. Vertigo. 2. Tinnitus. And 3. Impaired hearing, characterized by fluctuating, low-frequency hearing loss. There is also bursting of your Reisner's membrane, which causes the mixing of your perilymph and endolymph fluid, which are chemically incompatible. Unfortunately, there is no cure for Meniere's disease. However, it can be managed. How? By decreased salt intake and diuretics. The goal is to decrease your endolymphatic fluid, which increases the pressure in your inner ear, producing your symptoms. Okay? Okay. Sese.
Ano ba yan? Kawawa naman tong contestant nyo. Paano kaya siya naging ballerina sa lagay na yan? Anyway, ganito yon kasi Bon and Pula going steady. Ayon sa pagre-research ko sa buhay ni Ginoong Biko mula rito sa Boracay, si Ginoong Biko ay may acoustic neuroma. Minsan tinatawag din siyang neurinoma o kaya vestibular schwannoma. Nakuha niyo yan? Okay. Isang benign tumor sa 8th cranial nerve ang nagdudulot ng acoustic neuroma. Sa pagkakaalam naman nating lahat, ang 8th cranial nerve ay ang pinagsamang vestibular nerve, may kinalaman sa pagbalanse, at ang acoustic nerve na kailangan natin para sa pandinig. Kaya may problema si Ginoong Biko sa pandinig at pambalanse, hindi ba? Walang nakakaalam kung bakit at paano talaga nagkakaroon ng tumor sa loob ng mga ugat na ito. Ang may papayo ko lang, magpatingin na agad si Ginoong Biko sa neurologist, neurosurgeon, at neurophysiologist. Marami akong kilala dyan, i-contact niyo na lang ako. Mas magandang maagang maalis yung tumor para hindi na madama yung ibang nerves tulad ng facial nerve, syempre. Ayaw niyo namang maparalisa yung kalahati ng mukha ni Ginoong Biko, di ba? Kasi medyo may tsura naman siya. Sige, yan lang ang masasabi ko. Bye!
Okay. So the first 4 contestants were not able to finish the challenge because number 1 contestant, Mr. Banana, had BPPV, characterized by episodic vertigo without hearing loss. Number 2 contestant, our procurement officer, Mr. Brazil, had labyrinthitis and neuritis, characterized by continuous vertigo and hearing loss. Number 3 contestant, Ms. J.B. Baltasar, had Meniere's disease, characterized by episodic vertigo and hearing loss. Number 4 contestant, the primo ballerina Mr. Jonas Biko, had acoustic neuroma, characterized by continuous vertigo and hearing loss. So now we go to the question, why does the beauty queen, UNICEF volunteer, most awarded balanced nutritionist and dietitian Miss Carla Isabella Bonifacio deserve to win this challenge? Now we summarize her physical exam findings and let us recall SNNOOP for our criteria for judging. S for systemic, N for neurologic, N for neck, O for ophthalmologic, O for otologic, and P for psychiatric. So first, systemic findings of Miss Bonifacio showed that vital signs are normal, negative for arrhythmia. Neurologic findings showed unremarkable cranial nerve exam, no unilateral weakness and paresthesias, and no cerebellar dysfunction. Examination of the neck showed full range of motion and no bruits. Ophthalmologic findings confirmed that there were no errors of refraction, EOMs were intact, and no papilledema or retinal abnormalities. Otologic findings confirmed that Ms. Bonifacio has no AOM, CSOM, nystagmus, hearing deficits, and no vestibular dysfunction. And lastly, psychiatric findings obtained through the mental status exam showed no abnormalities in memory, concentration, and no aphasias. So now, back to our hosts, Bon and Pula, going steady to give the prize to our unbeatable and obviously undisputed winner, Miss Carla Bonifacio.